Hi, my name is Isla Domisness, and I've recently completed a degree in Bachelor of Health Science and Myotherapy. I'd like to thank you here today for having me to talk about myofascial dry needling and the possible treatment options for it. So, we are going to be discussing indications for myofascial dry needling, the clinical presentations of myofascial dry needling, the mechanisms of myofascial dry needling, and comparing acupuncture and myofascial dry needling and the differences. So, indications for myofascial dry needling include sports injuries and enhancing athletic performance by accelerating the healing process and restoring full function. Another indication is patients with myofascial pain syndrome. Myofascial pain syndrome is characterized by referred and localized pain that is apparent as deep and aching within the muscles, and also the presence of myofascial trigger points. A trigger point is either active or latent. An active trigger point presents as hyperirritable spots within the taut band within the muscle and the fascia, painful upon compression and produces characteristic pain as referred to as tenderness. Also can occur motor dysfunction. Another indication for myofascial dry needling is post-operative. So if a person's just come out of surgery, I found some really good research on the use of myofascial dry needling post-operative. So there was a research article on the inclusion of trigger point dry needling in a multi-modality physical therapy program for post-operative shoulder pain, a randomized control trial in 2015. The results from that showed that people with post-operative shoulder pain showed significant improvement in range of motion, pain, and strength and overall function. Another research article in 2013 was on the efficiency of myofascial trigger point dry needling in the prevention of pain after the total knee arthroplasty. These results showed less pain after dry needling was performed and really good results. Another indication for myofascial dry needling is it increases range of motion, reduces pain in the area of dysfunction, restoration of full function, restoring efficient muscle contraction and recruitment of the muscles, improving neurological conduction, also helps with movement impairments, and can be really helpful in TMJ dysfunction. So in temporomandibular pain syndrome, chronic lower back pain, lateral and medial epicondylitis, tendinosis, and migraines or tension headaches. So we're going to look at some clinical presentations, which include restricted range of motion and pain, myofascial pain syndrome, post-operative, and soft tissue damage. The mechanisms of myofascial dry needling are the stimulation of a local twitch response, so immediate reduction in neurological activity at the site of the trigger point and also reduces the pain. Another mechanism is the localized tissue damage from the puncture of the needle itself can promote positive inflammatory reactions, which promotes production of chemicals in the brain that therefore reduces the pain. So also another mechanism is the gate control theory, which is the ability to inhibit a painful sensation from the body part with its own sensory input, which is the insertion of the needle. Myofascial dry needling, also the muscle regeneration, which is the localized stretch to the cytoskeletal structures. Another mechanism is also the electrical polarization of the muscle and the connective tissue itself. So the mechanical needle stimulation pressure causes the collagen fibers to electrically polarize, which triggers the tissue remodeling, which can be really helpful in the process of healing. So we are going to compare the myofascial dry needling and acupuncture. So acupuncture originated from China 2,000 years ago. It's used for balancing yin and yang, clearing up meridians. So acupuncture can be used for a variety of conditions. The primary philosophy of acupuncture is that the body can be healed when chi or healing energy is released. So acupuncture is a more holistic and complementary practice, and dry needling is designed to relieve tightness and pain in the muscular and neuromuscular structures, practiced by physical therapists. So they're used both for healing the body, but very different ways. So when educating the client, we first do a musculoskeletal full assessment, which involves looking at the person's posture, the biomechanics, their issue, and where it might be coming from. Then we go on to treatment, which is where you can use a variation of needling techniques, which may include electrostimulation needling. Localized tenderness and possible bruising may occur, and it's a very normal response from myofascial dry needling. So we have to educate our clients and say this is a very normal response. And before doing the actual myofascial dry needling, we want to educate them in what's normal to expect and what isn't normal. Also, communication between other members in this multi-modality team in relation to the client's progress is a really important part of managing the client. So then we have some references and some further reading that we can look at. There's a lot of really nice journal articles used and referenced there. I'd like to thank you for listening to me today and for learning about myofascial dry needling and how it can help manage clients. And yeah, thank you.